Welcome to the deep dive. Today, we're really getting into something fascinating, the story of medication.
Yeah, we've got this great report that looks at it, all the history, uh, the ethical side, and crucially, where artificial intelligence might take us next.
Right. Our mission here is to explore how we, as humans, have always tried to heal ourselves, to live longer, and, well, how AI is looking like a potential revolution in that very basic quest.
And when we say medication, we're thinking broadly here.
Exactly. Not just the pills you pick up from the pharmacy.
No, it's any substance, really, any
Ah.
intervention, even practices used to diagnose, cure, treat, prevent, or just modify how our bodies or minds work, for health benefits. It goes way, way back.
Way before modern science.
And the word itself, drug, it's got an interesting history. Probably Old French, drogue.
Drogue.
Yeah, and maybe even back to Middle Dutch, meaning something like dry barrels.
Dry barrels, like for herbs.
Exactly.
Yeah.
Points right back to those dried medicinal plants, the natural origins.
It's amazing how the idea of what is medicine changes so much, does it? Across time, across culture?
Oh, definitely. What's powerful medicine in one place might be, I don't know, just food somewhere else, or poison, or
Oh.
part of a ritual.
Big difference between ancient magic and, say, a modern clinical trial.
Huge. But underneath it all, there's that constant human thing, right? That impulse to medicate.
Driven by what? Vulnerability? Pain?
Yeah, and just wanting to live longer, healthier. I think that's something you can probably relate to, that fundamental drive.
Okay, so let's dig into that history. We're talking a long journey from like shamanism up to modern science.
Right. Go back far enough, prehistoric times, ancient societies, medicine, magic, religion, they were all tangled up.
People thought illness was what? Angry gods? Spirits?
Often, yeah,
Mhm.
supernatural forces. So the healers, the shamans, they were the intermediaries. Their treatments were rituals, chants, but also herbs, real plants.
And the belief must have been huge. The power of suggestion, what we'd call placebo now.
Absolutely crucial. Belief in the healer, in the ritual. That itself would have had a powerful effect.
But it wasn't all magic, right? There's evidence of observation.
For sure. Like Neanderthals at Shenadar Cave, seems they used mallow and yarrow.
Which we now know have medicinal properties.
Exactly. And Ötzi the Iceman, thousands of years ago, he carried Boch polypore fungus.
For
Likely a laxative. Practical stuff. And people eating clay, geophagy, that was a thing too.
Wow. And even early surgery. Trepanning sounds terrifying.
It does, but they did it. Setting bones, using ant pincers like stitches, shows a hands-on approach, even if their theory of disease was different.
And this knowledge, it was just passed down orally.
Mostly, yeah. And women often played a big role, especially with herbal knowledge in families. Then you get to the big ancient civilizations, more cinematic stuff starts emerging.
Still mixed with the supernatural, though. Often.
Oh, yeah. Egypt,
Yeah.
you've got the papyri like Ebers, Edwin Smith, practical remedies alongside magic spells.
Mhm.
Figures like Imhotep,
And India had Ayurveda, right? Very holistic.
very, based on ancient texts, balancing bodily humors, that kind of thing. And China, with traditional medicine, acupuncture, massive herbal pharmacopoeia.
Then Greece seemed like a real shift. Hippocrates.
Yeah, the father of medicine idea. Big emphasis on looking for natural causes, observation, rational explanation, diet, exercise,
Mhm.
ethics too. Moving away from purely supernatural explanation.
The Romans took that and ran with it. More practical stuff.
They adopted a lot from the Greeks, yeah. But they excelled at public health sewers, aqueducts, even hospitals for soldiers, building infrastructure for health.
It's fascinating how much belief mattered, even in those early times. The report says something like, primitive physicians show their wisdom by treating the whole person, soul as well as body.
Right, which really
Mhm.
brings back that placebo idea. How much of the cure was actually the context, the trust, the ritual?
It must have been significant. The body's own healing power, just triggered by belief.
Very likely. And it really highlights the difference, doesn't it? Early drug discovery was this slow trial and error thing over centuries. Watching nature.
Compared to now, high throughput screening, AI.
Exactly. AI is like taking that ancient process and putting it on hyperdrive.
Okay, let's jump forward to what feels more like modern medicine. Those big breakthroughs.
Yeah.
Vaccination has to be top of the list.
Monumental, absolutely. Built on older practices like variolation.
I was using actual smallpox, right? Risky.
Very. Lady Mary Wortley Montagu was key in promoting it in the West, but Edward Jenner, 1796, that was the breakthrough using cowpox to protect against smallpox. Much safer.
And it spread. Benjamin Waterhouse brought it to the U.S. soon after.
And then think later, mid-20th century polio vaccines. Salk, Sabin.
Turning a terrifying disease into something preventable. The report estimates vaccines saved, what, 10 million lives just between 2010 and 2015?
Incredible numbers. Just staggering impact.
Then anesthesia. Hard to even imagine surgery before that.
Brutal. Unthinkable, really. There were earlier attempts, hints of it.
You've seen him mention something.
Yeah, but the mid-1800s, that was the real turning point. William Morton, John Collins Warren, demonstrating ether in 1846.
And chloroform followed quickly. Local anesthetics, too.
Right. Cocaine as a local anesthetic later on. It revolutionized surgery, made complex operations possible, relieved unimaginable suffering.
And antibiotics. The golden age.
That's the term, yeah. Fleming finding penicillin by accident in 28.
Just a lucky break.
Well, yes, but then it took immense work by Florey, Chain, Heatley to actually develop it for use. World War II really pushed that forward.
The need was urgent.
Desperate. And the impact of penicillin, streptomycin, huge drop in deaths from infections. But even before penicillin.
The sulfate drugs.
Exactly. Sulfonamides, 1930s, Prontosil, the first really broad spectrum systemic antibacterials.
They were in WWII first aid kits, weren't they? For U.S. soldiers.
Standard issue. The report mentions they might have caused something like a 3% drop in overall U.S. death rates just by themselves. Huge impact on infectious disease mortality, life expectancy shot up.
And other milestones, too. Insulin for diabetes in the 20s.
Critical antimalarials like quinine going back centuries. And then the 1950s, the first effective psychotropic drugs.
Like chlorpromazine. Changed mental health care.
Fundamentally led to deinstitutionalization, for better or worse. A whole new approach.
But these big changes weren't always welcomed immediately, were they?
No, definitely not. The report mentions debates, resistance, like the arguments between different medical schools or the opposition to anesthesia initially.
People thought pain was necessary.
Some did. It's a good lesson, maybe, for how things like AI might be adopted, rarely straightforward.
Yeah, progress isn't usually linear. It's messy.
Exactly. Serendipity, hard research, people from different fields working together. Penicillin's a perfect example. Fleming's observation, Floridian chains biochemistry, Pfizer's engineering for mass production.
Needs that collaboration, which feels very relevant for AI in medicine, too.
Definitely. Now, maybe we shift gears a bit. Look at medication through, like, an anthropological lens.
Okay, so beyond just the chemistry.
Right. Thinking of medicines as social things, cultural objects, they have meanings way beyond just their pharmacological effects.
The report calls it the anthropology of pharmaceuticals, looking at the whole life cycle.
Yeah, how a drug moves through a society, the transactions involved. Medicines can even become vehicles of ideology.
How so?
Well, they reflect and sometimes reinforce cultural beliefs about bodies, about health, illness. Think about how different cultures view psychiatric meds, for instance. The stigma, the perceived effectiveness. It varies hugely.
So the same pill can have a totally different meaning or impact depending on the culture.
Absolutely. Which is why just looking at the pure biology, the biomedical model, often isn't enough. Does the medicine make sense culturally? What does it mean to people? How does it fit into their lives? That affects how well it works.
That links to this idea of pharmaceuticalization, doesn't it? That tendency to medicalize more and more aspects of life.
It does. That desire you mentioned earlier, the user wanting to feel good all the time, kind of touches on this.
What drives it? Better drugs?
Yeah.
Marketing?
Bit of everything, probably. Medical advances, yes. Marketing, for sure. Societal expectations changing. Maybe just that basic human wish to avoid discomfort.
It raises questions, right?
Right.
Are we medicalizing normal life? Over-treating? What about autonomy?
Big questions. And the report suggests AI might actually speed this up.
And you mentioned placebo again, how the cultural meaning, the relationship with the doctor, the ritual of taking it, all affect how well it seems to work.
Exactly. It's not just the chemical, it's the whole package, which has massive implications for AI delivering treatments. How does an algorithm build trust? It's the AI bedside manner.
Can an AI have bedside manner?
That's that.
Yeah, that's a tough one. Okay, so medication isn't just one field. It pulls from everywhere.
Totally. Biology, chemistry, physics, math, logic, even philosophy. They all meet here.
Let's start with biology and genetics. Medications work on biological systems, obviously.
Incredibly complex systems.
Yeah.
And evolutionary medicine gives us interesting angles, like lifestyle diseases. Maybe they're a mismatch between our evolved biology and modern life.
Our diets, sedentary lifestyles, we didn't evolve for this.
Arguably not. The hygiene hypothesis is another example. less exposure to microbes early on might mess with our immune systems. So some meds are like trying to correct these mismatches.
But don't medical advances also have evolutionary consequences? If we help people with genetic issues survive and reproduce.
That's the point. It could increase those predispositions in the gene pool, maybe making us more reliant on medicine long term. It's complex.
And pharmacogenomics, how our individual genes affect drug response. That's huge for personalized medicine.
Absolutely. And AI is crucial there, analyzing all that genomic data. It's a shift, too. We beat back many infectious diseases. Now the focus is chronic stuff, aging populations.
Needing different drugs, long-term strategies.
Right. AI can help manage that complexity, predicting risks, handling multiple meds. And back to hygiene, it shows interventions aren't simple. AI might help untangle things like the microbiome, find therapies beyond just killing germs.
Okay, chemistry and physics. Chemistry is obvious, finding molecules, synthesizing them.
The absolute cornerstone. From natural stuff to lab-made molecules, medicinal chemistry is all about that structure-activity relationship. But physics is vital too, not just chemistry.
Diagnostics, right? X-ray, CT, MRI.
All physics-based imaging. Plus radiation therapy for cancer, nuclear medicine using radiopharmaceuticals, even things like lasers in surgery or the biomechanics in physical therapy.
It's a journey from roots and berries to these high-tech machines.
And AI feels like the next step, right? Designing molecules, optimizing radiation doses.
But that reliance on tech has downsides. Cost, access.
Big time. Expensive machines, need specialized training, creates disparities. AI can enhance it, but adds complexity too. Making sure everyone benefits is a huge challenge.
What about math and logic? How do they fit in?
Oh, fundamentally, you can't do modern medicine without them. Designing experiments, analyzing data, figuring out risks and benefits. It's all math and stats.
Like in clinical trials.
Yeah.
Working out if a drug actually works.
Exactly. Sample sizes, randomization to avoid bias, statistical tests, confidence intervals. It's rigorous. Plus, dosage calculations, modeling pharmacokinetics, how the body handles the drug.
And logic for diagnosis, putting the pieces together.
Definitely. Interpreting symptoms, test results, forming hypotheses. The report mentions Kahneman's System 1 and System 2 thinking.
Fast intuition versus slow analysis.
Right. Doctors use both. They build illness scripts, mental shortcuts. But it's an iterative process, dealing with uncertainty. Formalizing that reasoning is key.
And AI can help there. More precise diagnosis, predicting outcomes.
That's the potential, augmenting human reasoning. But we need transparency, right? Explainable AI can't just be a black box making decisions.
It needs to be understandable. And AI might help bridge that gap between the fast intuition and the slow, careful analysis.
Could do, spot patterns quickly, but also flag things that need that deeper System 2 look.
Okay, finally, the philosophical side. Seems medication touches on really deep questions.
It really does. Existence, suffering, well-being, meaning, it's all tied up in why we seek treatment in the first place.
To alleviate suffering, improve quality of life, basic human values.
Exactly. Even the WHO definition of health, complete physical, mental, and social well-being, that word complete is philosophically loaded, isn't it? Risks medicalizing everything.
And using medicine raises questions about the natural order, trying to overcome our biological limits. The report mentioned pharmacophy.
Yeah, this idea that pharmacology intersects with philosophy. Think about painkillers like morphine. They changed our whole relationship with suffering. But then the ethics, who gets access, massive inequality there.
And that user query again, feel good all the time, philosophically tricky.
Very. Some traditions see value in suffering growth, meaning a life with no challenges. Is that really desirable? So AI well-being tools need nuance, need to think about resilience, meaning not just constant bliss.
And the natural order idea keeps shifting, doesn't it? Vaccination, anesthesia, IVF, they all challenged it.
They did. Your point about altering the order of life is right on. And AI, gene editing, neuroenhancement, life extension will push those boundaries even harder. Needs serious societal discussion.
Okay, let's talk impact. Beyond individuals, how has medication shaped societies, history, even our biology?
The impact is enormous. Probably the most obvious is lifespan. Huge increase in life expectancy in the 20th century.
Mostly thanks to drugs and chemicals, antibiotics, vaccines.
Largely, yes. We talked about sulfa drugs reducing maternal mortality, vaccines preventing killer diseases. Antivirals turning things like HIV from a death sentence into a manageable condition.
But that success led to a shift, right? From infections to chronic diseases.
Exactly. The epidemiological transition. Now it's heart disease, cancer, diabetes. The lifestyle diseases are the main focus in many places. And improvements in lifespan lately often come from drugs targeting those.
But longer lives create new challenges. Aging populations, multiple chronic conditions.
Right. People needing lots of different meds, polypharmacy, long-term care needs. It's that feedback loop again. Success creates new problems to solve. AI might help manage that complexity.
And disease isn't static. Antibiotic resistance is a huge threat.
A direct consequence of our success, ironically. Plus environmental changes, climate change, spreading vector-borne diseases. We need constant R&D, constantly adapting. AI is becoming almost essential for that, analyzing pathogens, predicting resistance, accelerating new drug discovery. It's an arms race.
What about the impact on our minds? Psychotropic drugs.
Profound. Changed how we understand and treat mental illness, impacted quality of life, societal views, even how people see themselves.
The mid-20th century was the turning point. Chlorotramazine.
Yeah, around 1951. For psychosis. A miracle drug, they called it. Played a huge role in deinstitutionalization.
Then the tranquilizers.
Yeah.
Valium, Miltown.
Yeah.
The happy pills.
1950s, 60s. Became cultural icons. But controversial too, addiction, gender politics surrounding them.
And later, antidepressants like Prozac, SSRIs.
Late 80s. Better tolerated for many became widely used. But still debates about side effects, long-term impact, how much better they are than placebo for some people.
It's not just psychotropics, though. Any medication can affect mood, thinking, sense of self.
True. The opioid crisis is a horrific example of that complex interplay.
And these drugs fueled medicalization, right? Defining more things as medical problems needing a pill. The chemical imbalance idea.
Yeah, it expanded medical definitions, sometimes maybe oversimplifying complex issues. That feel good all the time idea connects here. AI could potentially refine this even further, raise more ethical questions about enhancement versus treatment. What is a healthy mind? Is there value in sadness, anxiety sometimes?
And the societal effects are huge, too. Tranquilizers and gender roles back then, antipsychotics and closing down the big institutions.
Exactly. And future AI tech, like AI companions, what unforeseen social changes could they bring? How might they affect relationships, dependency? We need to think ahead. It's interesting how society reacts to breakthroughs. It's not always simple acceptance.
No, definitely not. Big changes often bring enthusiasm, sure, but also skepticism, moral outrage, ethical debates. They force us to rethink things.
Like the birth control pill in the 60s. Huge for women's autonomy, for many.
But massive religious objections, debates about family, sex.
Right. Or anesthesia back in the 1800s. We mentioned the opposition, religious arguments, medical arguments, that pain was important somehow. Took time and proof to overcome.
Organ transplants, too. Defining death, donor shortages, who gets one. Huge ethical questions.
Still ongoing. And IVF, test tube babies. Started with huge controversy, unnatural, embryo status, multiple births. Now it's common, but the ethical debates continue.
There's a pattern, isn't there? New medical tech forces us to confront our values.
Always. And AI, gene editing, neuroenhancement, life extension will do that even more intensely. We need proactive discussion, ethical frameworks, ways to govern this inclusively.
And adoption isn't just about the science. Media, activism, politics, money, they all play a role.
For sure. Think happy pills as cultural icons. How IVF became accepted. How anesthesia faced down opposition. AI adoption in healthcare will be the same, shaped by public trust, media narratives. Transparency is key.
What about medication in crises? Pandemics, wars, disasters?
Those times really highlight how vital medicines are, but also expose the weaknesses, the inequalities. They test everything: resilience, capacity, ethics.
Like the 1918 Spanish flu. Before antivirals, vaccines.
Exactly. Overwhelmed systems, care was mostly palliative. Secondary bacterial pneumonia killed many. Nursing was critical.
And COVID-19 more recently. Incredible vaccine development.
mRNA vaccines, antivirals, amazing speed, but also stark global inequality in access, wealthy versus lower income countries. Huge ethical questions about sharing resources.
War often spurs innovation too, doesn't it? Trauma care, infection control.
Yeah, WWII saw sulfa drugs, penicillin really take off, benefit civilian medicine later, but war also destroys infrastructure, blocks access, creates humanitarian nightmares.
Natural disasters too. Overwhelm capacity, destroy supplies, create urgent needs.
Injuries, infections, people needing their regular meds for chronic conditions. It's immense pressure.
And these crises always bring up the hard ethical questions about who gets what. Limited ICU beds, vaccines.
Exacerbates existing inequalities. AI might help optimize allocation, manage supply chains in theory, but you need ethical rules to make sure it's fair. Doesn't just reinforce the disparities.
Crises can accelerate innovation, but the challenge is making sure the benefits are shared.
That's the core ethical challenge. Global health security, equitable sharing, not just national or corporate interests.
Okay, this brings us squarely into the ethical labyrinth, as the report calls it. The moral dimensions are everywhere.
Absolutely. From discovery to use, it's packed with ethical issues. Basic principles, research rules, pricing, access, marketing, big life-altering stuff.
Let's start with those basic principles. Autonomy, beneficence, non-maleficence, justice.
Right. Autonomy, the patient's right to decide for themselves. Informed consent, no coercion. Beneficence, acting in the patient's best interest. Doing good. Non-maleficence, first, do no harm, weighing risks and benefits.
Yeah.
And justice, fairness, equitable access and treatment.
These are the foundations. But they can conflict, right?
Often. Beneficence versus autonomy is a classic patient. Refuses a treatment the doctor thinks is vital. And these principles evolved. Hippocratic Oath is ancient, but things like the Nuremberg Code.
After the Nazi experiments.
Exactly. Established informed consent as non-negotiable. Then the Declaration of Helsinki for research ethics, protecting vulnerable groups. These are the bedrock now.
And that tension, autonomy versus doing good, AI information tools need careful design there. Support choice, don't push people.
Crucial. Avoid digital paternalism. And the shift towards human rights principles and ethics came from past abuses. We'll likely see something similar with AI self-regulation first, then harder laws for accountability. History lessons are important. Let's trace that journey from discovery to patient. Research and clinical trials, huge ethical focus there.
It's a long road, and ethics have to guide every step. Informed consent is key.
Absolutely. Voluntary agreement, full information purpose, risks, benefits, alternatives, right to withdraw. Making sure people understand, especially complex trials or vulnerable patients, that's the challenge.
What about placebos? Are they ethical if a real treatment exists?
Big debate. Generally, less ethical to withhold a known effective treatment if it means serious harm. More justifiable if there's no standard treatment or it's not a life-threatening condition. Randomization, assigning people by chance, is vital for good science, but tricky if people feel one group is getting better treatment.
And protecting vulnerable participants. Children, pregnant women, prisoners.
Needs extra safeguards, often extra consent processes, and always that risk-benefit assessment by ethics committees, IRBs. Does the potential knowledge gain justify the risks to participants now? Bad science is unethical science. Ethical issues pop up in every phase. Phase 1 is mostly safety, low direct benefit to volunteers.
Relies on altruism.
Pretty much. Phase 2 starts looking at efficacy. Phase 3 is the big confirmation trial, comparing to standard care or placebo. Phase 4 is after approval, long-term monitoring. Each has specific ethical points.
And the history of unethical research like Tuskegee hangs over all this.
Precisely why the codes and oversight exist. There's always that tension. Individual risk versus collective good. Needs strong protections against exploitation. AI might help better preclinical models, better trial design, maybe identifying responders earlier, but the AI tools themselves need ethical development.
And informed consent isn't just signing a form. It's real, understanding, voluntary choice.
Which can be hard with complex info, or if people feel pressured. AI could help with interactive explanations, checking understanding, but also potential for manipulation there too.
Okay, the economics, price, profit, access. This hits that price on those lives nerve.
Exactly. It's critical, determines who gets treated. That phrase really captures the unease about health as a commodity.
There was a shift, wasn't there, from nonprofit university research to big for-profit pharma.
Yeah, driven by the sheer cost and complexity of modern R&D needing massive private investment. For-profit has driven innovation, brought drugs to market, chased blockbusters.
But the criticisms, high prices, neglecting diseases of the poor, marketing.
All true. Prioritizing profitable markets, aggressive marketing, patent games. We do still have nonprofits trying to fill gaps, affordable generics, neglected diseases, but they face uphill battles. It's that core tension, shareholder value versus public health mission. AI could disrupt this, maybe lower R&D costs. or make things worse if AI drugs are super expensive.
And who pays for the initial innovation? Lots of it is public money, right? NIH, universities.
A huge amount. Most foundational biomedical research is publicly funded. The report cites a study saying nearly all FDA-approved drugs between 2010 and 2019 originated from public research.
So taxpayers pay twice, fund the research, then pay high prices.
That's the argument. Public benefits, sure, but companies profit hugely. It's often called de-risking public money for the risky early stuff, private money for later development. Seems an imbalance in the return on public investment. With AI, we really need frameworks for fairer returns, reasonable pricing for AI drugs from public research, maybe open source AI platforms.
Even debates about university overhead costs reflect this tension.
Right. Cutting that could stifle the basic research AI builds on. We need sustainable funding for public AI research, too.
And drug pricing itself, ethically loaded. Why are U.S. prices often so much higher?
Complex question. Different pricing models exist. Cost plus, add up costs plus profit. Seems fair, but doesn't reward efficiency or value. Competitive price based on rivals. Doesn't reflect true cost benefit. Value-based link price to health outcomes like QALYs.
QALYs, quality adjusted life years.
Yeah. Sounds good, but putting a dollar value on a year of healthy life. Very controversial. AI might help assess value with data, but we still need an ethical agreement on what value means.
Pharma says high prices fund R&D risk. Future innovation value delivered. Critics say.
Critics point to Me Too drugs, public funding, marketing costs, patent tactics. The result is clear. Financial hardship, people skipping meds, access gaps, lack of transparency doesn't help. AI might increase transparency, but needs regulation and willingness. The core ethical dilemma is balancing innovation incentives with affordable access for all. Is health a right or a commodity? And this access issue is global. Billions lack essential medicines, especially in low and middle-income countries.
It's seen as a human right now, isn't it? Governments have obligations, WHO essential medicines list.
Increasingly, yes. But the barriers are huge. Affordability, high prices, especially for patented drugs, lack of national resources or political will, weak regulations, staff shortages, intellectual property rules like TRIPS delaying generics, R&D focused on rich markets, neglecting diseases like malaria or sleeping sickness, weak supply chains, poor infrastructure.
So even if AI helps optimize selection or distribution, the main problem is political and economic will.
Largely, yes. And AI drug discovery could even worsen access if we don't create new global models. Patent pools, tiered pricing, compulsory licensing for essential AI-discovered meds.
What about marketing? The ethics of persuasion.
Big area. Marketing shapes prescribing, patient demand. Its goal is sales, which can conflict with evidence-based patient health.
Key issues are things like misleading ads, downplaying risks, promoting off-label uses.
Right. Regulations exist, but enforcement is tough, especially online. Then there are financial ties to doctors' gifts, fees, grants. Potential conflict of interest erodes trust. Transparency laws help, but maybe not enough.
And a direct-to-consumer ads. Only U.S. and New Zealand.
Yeah. Supporters say it empowers patients. Critics say it drives demand for expensive drugs based on hype, pressures doctors, leads to overprescription. Lack of unbiased info is a problem generally. And targeting vulnerable groups is obviously ethically dubious.
Those financial links between pharma and doctors are tricky. Collaboration is good, but influence is bad.
Exactly. AI decision support could offer an objective view if it's free from bias and transparent. If AI becomes the info source for patients, its design needs careful ethical scrutiny. Finally, the really big picture stuff. Life extension, natural order. Our power to intervene raises deep questions.
Especially radical life extension. Lots of enthusiasm, but also serious concerns.
Ethical objections often center on justice and inequality. Who gets it? Likely the rich first, creating a massive divide, unequal death. Also, maybe it's misprioritizing, focusing on lifespan over quality, community, meaning. Could society become stagnant, risk-averse? What about the quality of those extra years? And planetary limits, resources, population?
The natural order argument keeps coming up, but medicine has always changed that order.
Constantly. Playing God gets debated with every major advance. Radical life extension is just the biggest challenge yet. AI breakthroughs here demand global ethics and fair distribution, way beyond what we have now. Or it could get dystopian fast. That price on life becomes even sharper. Maybe the focus should be quality of life for everyone. Connection, meaning, well-being. Not just more years at any cost. Okay, let's shift focus fully onto AI now. This really does feel like a potential paradigm shift for medication.
How so? What can AI do that's so different?
It offers capabilities we just haven't had before. Accelerating discovery, truly personalizing treatments, boosting diagnostics, maybe even helping with some of those ethical and logistical knots.
Right, let's start with drug discovery. She said the traditional process is slow, costly, high failure rate.
Notoriously so. AI, especially machine learning, generative AI, is starting to shake that up significantly.
Where does it help? Early stages.
All through the pipeline, identifying new drug targets much faster by analyzing massive biological data sets. Generative AI can even propose entirely novel targets. Then, finding hits molecules that interact with the target. AI can screen millions virtually, predict properties, even design new molecules from scratch. Atomwise is one example doing this.
Predicting if a drug will work or be toxic before human trials.
That's a huge goal. Could cut down failures dramatically. AI is also great for drug repurposing, finding new uses for old drugs. Benevolent AI finding baricitinib for COVID is a case study. And even optimizing clinical trials, finding the right patients, predicting response, monitoring.
Are companies actually using this, seeing results?
Oh yeah. In silico medicine, Exscientia, Recursion, these AI-first companies are showing promise. Some report higher success rates in early trials. It can definitely shorten timelines, increase the odds.
But it doesn't replace human trials.
No, absolutely not. Rigorous testing in people is still essential for safety and efficacy. AI optimizes the process, improves the candidates going into trials, reduces early failures. That's the main impact right now.
You mentioned data earlier. The quality of data for training AI is critical.
Absolutely fundamental. Garbage in, garbage out. Plus, huge issues around data ownership, privacy, security, and bias. If the data reflects health inequalities, the AI tools might perpetuate them, making things worse for some groups. Ethical sourcing, diverse data, constant checking for bias, it's non-negotiable for fairness. Now, personalization, tailoring treatments. AI seems perfect for that.
Because it can handle huge amounts of complex data about one person.
Exactly. Genomics, proteomics, all the omics. Finding those tiny variations that affect disease risk or drug response, especially in cancer. Plus, mining electronic health records for patterns. Adding in real-time data from wearables, apps, integrating it all for a truly holistic view.
So AI could predict disease risk better. Choose the best drug for me. Get the dose just right.
That's the vision. Optimizing treatment selection, personalizing doses, predicting and avoiding adverse reactions. Systems like Curate.ai are exploring this. It speaks directly to that idea of treatments making you feel as good as possible because they're optimized for you.
But the hurdles are big. Data sharing, trust.
Huge. We need secure, connected data systems, which we mostly don't have. Patients need to trust that their data is safe and used ethically. Things like federated learning might help with privacy. Without solving the data infrastructure and trust issues, personalized medicine via AI remains limited.
And we need to remember, people are more than data points, right? Psychology, culture, values.
Crucial point. Risk of being too reductionist. AI will likely be a tool for clinicians who then integrate those insights with their human understanding of the whole person in a shared decision. Let's talk diagnosis. Getting that right is step one. AI can help there too.
Big time. Diagnostic errors are a real problem. AI, especially deep learning, computer vision, is getting incredibly good at analyzing medical images, X-rays, CTs, pathology slides.
Better than human experts sometimes in specific tasks, yeah. Finding subtle signs of cancer on mammograms faster, more accurately. Assisting radiologists, spotting things the human eye might miss. Analyzing tissue samples with high precision in pathology.
And beyond images, using symptoms, history, labs.
Yes. Processing all that diverse data to suggest possible diagnoses, flag urgent issues, really useful in complex cases or busy environments. Clinical decision support systems driven by AI can offer real-time prompts, check interactions, suggest tests.
But the black box problem is big here, too. Doctors need to understand why the AI suggests something.
Absolutely. For trust, for legal responsibility, we need explainable AI, XAI, so clinicians can validate the reasoning. And we need to train doctors differently, help them work with AI effectively, understand its strengths, weaknesses, ethical pitfalls. AI as an assistant, enhancing judgment, not replacing it.
Okay, this brings us back to the new ethical challenges AI introduces.
It does. We need to be proactive to ensure it's used safely, fairly, aligned with our values.
Bias is a major one you mentioned. AI learning from biased data.
Right. If the data reflects health inequities, the AI can amplify them. Tools might work less well for certain groups, worsen disparities, needs commitment to equity from the start, diverse data, fairness checks, ongoing audits.
And privacy, security. AI needs so much sensitive data.
Requires super robust governance, strict compliance with rules like CIPA PR, GDPR, privacy-enhancing tech. Accountability is another tough one. Who's responsible if an AI makes a mistake? The developer, the hospital, the doctor. AI itself, especially if it's a black box, need clear legal frameworks.
Informed consent for AI use, too. Patients need to know.
They have a right to know, understand the role, risks, benefits. And transparency, explainability, we keep coming back to that. Trust requires understanding.
How do we make sure AI actually reduces health disparities, not widens them?
Critical question. Needs deliberate strategies. Inclusive design involving diverse communities, bias mitigation techniques, addressing the digital divide, access to tech, internet, promoting AI literacy for everyone, governance that prioritizes equity. It can't just be tech-driven. It needs social awareness, commitment to justice.
What about AI for holistic well-being? Back to feeling good all the time.
AI is moving into mental health support chatbots, CBT apps, AI companions, social robots, maybe cognitive enhancement down the line.
But is feeling good all the time even the right goal?
Probably not. Life needs contrast. The hedonic treadmill means constant bliss might not even work. Maybe AI's role should be fostering resilience, connection, navigating emotions, not just eliminating negative ones. And empathetic AI. Can AI truly be empathetic without feeling? Risk of false connection, eroding human empathy, maybe? AI is assistive, not replacement.
Could AI help foster empathy on a societal level? Maybe through simulations?
Potentially cognitive empathy, yeah. Understanding perspectives through data-driven narratives. But it's not shared experience. And the idea of AI giving us better logic about life, well, AI is logical, yes, but meaning, value, life is all there is. That's philosophy, existential stuff. AI can be a tool for reflection, maybe, but not dictate meaning. That's still on us.
So, wrapping this deep dive up, we've gone from ancient remedies, magic herbs, all the way to AI potentially designing personalized drugs. An incredible arc.
Yeah, and hopefully for you listening, this has hit that mark, giving you a thorough understanding, those aha moments about how our quest for health has evolved and where it might be heading.
And AI really does seem to offer a chance to maybe fix some of the broken logic around access and pricing.
If we steer it right, yeah. Lower R&D costs, empower nonprofits, optimize supply chains, enable fairer value-based pricing. It could drive equity, but only with the right ethical frameworks and policies in place.
It's clear we're in this constant coevolution, humanity and its medicines. AI is just the newest, maybe most powerful influence yet, pushing us to rethink health, disease, even what it means to be human.
So looking forward, if we want AI to genuinely benefit everyone, we need that interdisciplinary work, strong ethics, transparency, focus on equity, new economic thinking, education, a broad view of well-being, and government that can keep up.
It's a huge list.
It is. And maybe the final thought for you to chew on is this. We have this immense responsibility now, shaping medication's future with AI. What do we prioritize, profit or people? That choice will really define our collective health and well-being going forward.
Something to think about. We hope this deep dive gave you plenty to consider regarding AI's role in your own life and the future of healthcare. Thanks for joining us.
This is DigitView.